My name is Crystal Stinson. I am an LPN in the RN program at Hudson University. I will be giving you a speech on cardiopulmonary resuscitation. The function of the heart is to carry, well, the sinatral node is the pacemaker of the heart, and it functions as the starting point of where the blood flows throughout the heart, and the blood carries oxygenated blood to your cells and the other organs in your body. The function of the lungs is to bring in oxygen and to carry out carbon dioxide of your body. The American Heart Association defines cardiac arrest as being without breaths and without heart activity. At that point is the point where you would need CPR. Say that you're out on a beautiful sunny day and you're having a good time with your family and all is well and you're laughing and playing and the grill is going, the sun is shining, nothing's wrong. And you look over at your baby girl and she's jump rope with her friends, and then all of a sudden she stops and you see her grab her heart and she starts gasping for air, and you watch the color leave her face and you kind of like, what's going on? So you start walking and you see her fall to the ground. You take off running, you scream, you yell, you holler, but what else do you do? And that is the point where CPR comes into play. And CPR is basic CPR is what I'm teaching you. Is just chest compressions and breaths combined. Basically, I'll take you through those steps. The first, very first step of CPR, basic CPR, is to yell for someone to call 911. It's better to appoint somebody if you possibly can, like directly point at somebody to call 911. Then as the person is laying there, you check for breathing by putting your ear to their mouth, and you check for the pulse on the side of their neck. If you don't feel either one, that person has went into cardiac arrest. Some of the causes per the Mayo Clinic of cardiac arrest are shock. Mostly in kids is trauma to the heart where they've gotten hit with a baseball or some object like that. It's mostly in kids. When you recognize somebody is in cardiac arrest, those first few seconds are the most vital time. So that is the time where you take your hands and you interlace your hands and you put them between the breasts, either a man or a woman, it does not matter, between the breasts, and you press down 1.5 inches and you let the chest rise and fall evenly 30 times. If you're not comfortable or in a situation where you can put your mouth to mouth on someone, then just keep doing the compressions. That's fine too. That's been approved by the American Heart Association as well. You just keep the compressions going. You do not stop CPR until either the person has a pulse, which you would check for after 5 cycles. You check the pulse. If the person has a pulse and is breathing, then you turn them over into the recovery position, which is on their side. And that's in case they vomit. You don't want them to aspirate or basically any food or product that they've choked on or any saliva to go into their lungs. And that you perform CPR until they recover or until the paramedics actually take over, not when they arrive. I would like to demonstrate CPR for you with 2 people, an adult and a child, if I possibly could. So we'll start with Miss Talicia. If you can come up for me, please. And Talicia is 4 years old, and we're going to ask her to lay down this way. Lay down. Perfect. Just like that. And for CPR with a child that's under the age of 9, their heart is smaller, so you don't use 2 hands, you use 1. And you take your hand and you just push between their chest. And then you tilt their head back and you give 2 breaths. And then you push 30 times. And then you tilt the head back and give 2 breaths. And you continue until she recovers or until 911 actually takes over. If she recovers, you place her on her side and you let her just get her breath, and then of course the 911 will take over and get her some recovery help and take her to the hospital. Thank you. And for an adult person, we will have Dee come up and we will show you CPR on Mr. Demetrius. And Mr. Demetrius is a tower technician, so he goes way up. So if anything were to happen, he would definitely have to know exactly what to do. So we will have Demetrius lay down for us, and we'll show CPR on Demetrius. So for Demetrius, since he's a man, we would take our hands and push down. I didn't push for real, he's just an exaggerator. Push down. Or you would take your hands like this and push down 30 times and tilt his head back and give 2 breaths. And you just continue. So with the child, it's 1 hand. With the adult, it's 2 hands. And if you want to, if you're only comfortable with the chest compressions, you just do that. And that's how you do basic CPR, which should be applied immediately. So in conclusion, if you're in an emergency situation, the best thing is to act. No matter if you do just the hands-on or just the respiration, or just the hands-on without the respiration, you should still act. And as long as you act, you are helping the body restore the circulation. And that's it. Thank you.